So again, good afternoon to everyone. So let us continue with our discussion. So last time we had a discussion pertaining to concepts that will significantly introduce all about the normal physiology of pregnancy and how the drug affects its absorption because of these physiologic changes. We have also discussed last time the topics related to those substances that are somehow being abused during pregnancy. I have reiterated and we have already discussed on the effects on the maternal and effects on the fetal and neonatal effects. So from the alcohol, tobacco, cocaine, heroin, methadone, these are the commonly abused substances, even caffeine. If it's abused, even with the 2 cups and 6 to 8 cups, this may lead to a possible problem with the fetus on the certain condition when it comes to its well-being. Now, uh, here in the Philippines, Filipinos, when it comes to culture, have been oriented with the use of herbs, herbal medicines, use of natural sources, aside from the pharmacological management available in the uh, commercial settings. Now, there are therapeutic drugs and use of herbs in pregnancy. If it is proven by if it is authorized by the Food and Drug Administration of the Philippines, then it could be safe. But most of the herbs may cause the possibility of birth defects and possible leading to spontaneous abortion if it is not taken appropriately. So most common indications of use of drugs during pregnancy. So we are aware that the fetus are very much dependent with the maternal circulation. However, this may not be sufficient because as what I've told you, there are pregnancy physiologic changes that eventually will affect also the recommended daily allowances or needs of the mother and the fetus as well. Those changes that occurred is the expansion of the circulating blood volume, which makes pregnant individuals as anemic, and in the succeeding trimesters or late first trimesters, there are also identified deficiencies which pertains to vitamin B, and this may affect specifically also the fetal well-being. We all know that the vitamin B may have specific association when it comes to the functions of the nervous system, while the problem with the expansion of the circulating blood volume that may lead to a possible anemia. So the therapeutic drugs that we are talking about is it will supplement nutrition with iron, vitamins, and minerals, which is very much common with the conditions of pregnancy, which I have already explained to you in terms of the physiologic changes. Now, when it comes to other physiologic changes, there are discomforts that most pregnant women experience when it comes to first trimester. The most of the discomforts are in the first trimester. However, the therapeutic drugs and use of herbs in pregnancy, some of it are definitely acceptable. But there are some situations that it may not be acceptable because it may affect the fetal well-being. However, when it comes to nausea and vomiting, we have been aware that the cause is pertaining to the gastric change when it comes to the pH. It becomes more acidic, and the other mild discomforts that our pregnant clients experience is because of this increased acidity may cause the possibility of nausea and vomiting. there are acceptable herbs that may specifically consider in the prevention or in the prevention of the or alleviation of this signs. However, we must be careful also and be cautious about it. Now, one of the concerns that had been identified when it comes to the expansion of circulating blood volume for pregnant women is specifically a concern with the blood. And it is expected, okay, it is expected that a mother could be high risk of the maternal iron deficiency anemia. So this usually happens at the early third trimester. And usually it happened, anemia is expected because of the decrease in the hematocrit. Okay? Class, when we talk about hemoglobin and hematocrit, the hemoglobin really acts to carry oxygen, significant for the cellular functioning. However, the hematocrit is also affected when there's significant decrease in the level of RBC and the level of RBC and the level of hemoglobin as well. So if there will be decrease in the hematocrit, it is expected that the blood has low volume and at the same time it is less viscous, which the capacity of the the capacity to carry oxygen may not be effective as well. So it may affect significant oxygen transport for the mother, and at the same time it may affect the oxygen transport for the fetal circulation. So that's why iron is one that had been identified to consider and definitely to prevent maternal iron deficiency anemia. So expect decrease in hematocrit at the early third trimester. So again, what's the effect if there will be decrease in the hematocrit? So obviously it may decrease also the capacity of carrying oxygen or to transport oxygen. That's why it may have a higher recommendation of iron when it comes to daily allowances. For pregnant women, the iron intake is recommended 27 milligrams per day for pregnant mother, while 18 milligrams per day for those who are non-pregnant aging 18 to 30 years old. So a difference of almost 9 milligrams per day for pregnant women compared to the non-pregnant women, because eventually it may need, as what I have mentioned, the basis and the reference why it leads to this problem is because of the expansion of the circulating blood volume that is essential for fetal circulation. Now, when a doctor or an obstetrician will definitely advise clients to take iron supplements. So most that are familiar with you are ferrosulfate, right? These are free actually in health centers. You can avail, pregnant mothers can avail these medications or supplements rather. However, we must take into consideration that the side effects. So we have mentioned that the side effects are the expected physiologic and biologic response of the body when it comes to the effect of the drugs. So as what I have told you, when you take iron supplements, the one of the most common effect and rather observations that you may have, most common, the iron is commonly metabolized by the liver. So that's why when there will be secretion of the bile, the intestine, the excretion may not be through the kidney. The iron as metabolized by the liver could be excreted via stool. So that's why it is expected for anyone who's taking iron-based supplements, even ferrosulfate as well as mentioned, may lead to a possible black tarry stool. So that's why one of the questions that you may raise to your clients is if the client address to you as nurse that they have this black tarry stool. Kasi this black tarry stool is an alarming condition for a common nurse who may ask and who may address, for a client who may address the nurse on this condition, because probably this is an indication of intestinal bleeding. However, the other way around is if you have done history taking, including the medication history, if the client is presently taking iron, then it is expected that the elimination goes with the GI tract, which means that its effect may lead to black tarry stool. Other than that, since commonly, very common when it comes to oral medications or iron-based oral medications are irritations with the gastric, and thus leading this to a possible nausea and vomiting, because again, as what I have told you, the gastric pH for a pregnant clients are increasing. Thus, a patient will take an oral medication, it will further increase, and possible that it may cause a premature breakdown of its chemical properties. So that's why the increased hydrochloric acid may significantly affect its reflux and possibly may induce the nausea. So what could be later on, we'll try to have some of the basic interventions on how to alleviate conditions or discomforts with nausea and vomiting. And later on, I'll be discussing also the medications or drugs related on this discomforts. So if this could be the side effect, what will be the nurse's intervention? Because we need to always in support. It's not just only saying to the client that, ma'am, it's normal because it's side effect. No, because if this could be considered as a side effect and possibly it may cause vomiting, then the possibility that the client will be high risk of dehydration. So what could be your nurse responsibility when the side effect goes in or experienced by or experienced by our client, then support it with fluid, increased fluid intake, monitoring of intake and output. Then when it comes to gastric irritations, then as much as possible the drug can be taken in full meal so that it may prevent gastric irritation or possibly after meal. However, other than the black tarry stool, which is very significant as side effect of iron-based supplements, it may cause also discoloration of urine and possible diarrhea. But most common, the pathognomonic side effect or the peculiar side effect that are very common to all iron-based supplements are significant with black tarry stools. Now, these are some important nursing implications when you are advising the client in taking the iron-based supplements. Usually, we have, other than the capsule, we have also liquid forms. Okay, and usually liquid forms could be for pediatric, and liquid forms could be also available for the adults. Now, for liquid forms, this may cause tooth discoloration. There could be yellowish discoloration of the teeth. So it may be permanent. So it may cause staining. So that's why if ever you may administer a liquid form of iron-based supplements, it could be straw or yon, i-straw para at least it may not have a contact with the teeth. So expected yan ha, pagka liquid form, iron-based supplements in the liquid form may cause discoloration of the teeth. So however, as what we have mentioned, to prevent the side effect of nausea and vomiting, it is best to give it in full stomach. However, as part of the nursing implication, we are talking about side effects. But once initially you will take it, it is best absorbed with water or juice on an empty stomach. The juice may not be high acidic juices. non-acidic or low acidic juices, vegetables, either vegetable juice or fruit juice. And this could be given on an empty stomach, only supporting with water and juice. Then afterwards, after intake of the drug, then the client may have the meal. Another is usually the pregnant mothers are being advised to uh, take iron supplements with vitamin C. Why? Because when the pregnant client will take vitamin C and at the same time with iron-based supplements or ferrous sulfate, it will increase absorption of iron. So it will facilitate. So the interaction with it is best to consider intake of vitamin C and iron at the same time because it facilitates effective absorption. Now, you need to take into consideration, since we have already discussed about interactions, do not administer iron with milk, cereal, tea, milk tea, coffee, or eggs. Why? Because it can counteract absorption of iron. Again, this is very important, ha? You must advise not to take iron with this food. Most, if you have noticed, milk, coffee, tea, and eggs. Because the rationale with that is it can counteract the effect of iron. Any question with iron before we proceed with the folic acid? Any question, class? You're still with me?
Yes po.
Yes po.
Yeah, Miss Abilino, question.
Sir, bakit po hindi pwedeng sabayan ng milk yung iron?
Yeah, because it can counteract absorption. The components of this food, common with milk and common with coffee, as well as with the cereal and tea, it usually counteract iron. So when you take the iron supplements with these drugs, it may not be absorbed effectively. So that's why best not to have it. That's why I even mentioned that it could be best absorbed only with water or juice, low acidic juices. And somehow, sir, how about naman if I will have the intake of high acidic juices? It will counteract absorption as well. How it means? It will cause the increased hydrochloric acid and it may cause premature breakdown of the chemical components of the drugs. Okay, a question. Din, pero pwede pa rin po bang kumain ng cereal milk kahit hindi umiinom ng iron? Okay, now, it could be, but do not have the intake of this milk, cereal, tea, coffee, or eggs along with the intake of iron. So there must be an interval. When you take iron, then after an hour or after 30 minutes, you can have this food. The advice lang is do not have the iron with or mix with this food or at the same time. You take the iron while drinking milk. Take the iron supplements while eating cereals and eggs. So it may counteract specific absorption. So din pwede po bang mag-cereal after taking the iron? Yes, pwede naman po. But there must be an interval so that it may allow the absorption primarily of the iron. Okay? Because once the iron supplements reaches the stomach, it will start already the synthesis for absorption. But if you will have it intake, example, the milk, you have taken it with the milk and then at the same time iron sabay, then that will counteract its effect. So hoping I have answered your questions. Any other questions about iron supplements? These are very common for pregnant women and very common for pediatric clients because iron are very much advised to someone who have or who are experiencing anemia. Any other questions? Okay, hearing none, so we'll proceed with the next slide. The next slide is referring to the second important drug that are given to pregnant women. Aside from the iron, so what is our rationale of giving the iron supplement? It's because on the early third trimester, there will be decrease in hematocrit. Okay? So that is very evident. Okay? Now, aside from those drugs, it is also advisable to increase food that is rich in iron aside from the supplement. That's why I even emphasize to you, before leading to pharmacological management, proceed first with the nutritional and natural sources that our body will synthesize to reserve this iron. And the iron supplements, most are given for a pregnant mothers who are active, who are in active physical activities, or those who have history already of blood disorders. So that's why this could be a supplement to prevent such anemia. Okay. Now, pertaining to folic acid. Okay. The difference why we have the iron is to prevent the maternal iron deficiency anemia. And the point that we have considered folic acid is to prevent birth defects. Eventually, to prevent folic acid deficiency. It's identified with vitamin B9. Kasi vitamin B6 is pyridoxine eh. Vitamin B9 is for the folic acid. Now, for 2 to 3 months pregnant, advisable, recommended daily allowance could be 0.4 milligrams to 0.8 milligrams for 2 to 3 months who are pregnant, which is obviously covered by the first trimester. However, continuous intake could be 180 microgram recommended daily allowance. Okay. So from this 0.4 milligrams to 0.8 milligrams 2 to 3 months pregnancy, 180 micrograms recommended daily allowance are advisable either from natural sources or supplemented by a folic acid or for a drug or a folic drug that will supplement and prevent folic acid deficiency. So what is the problem with the folic acid? Since we have identified folic acid as vitamin B, so it's somehow related to the nervous system and somehow related to the development of the embryo. Folic acid deficiency may result to spontaneous abortion. Okay, because the question is why? Because there could be a possibility that it may not support the development of the embryo. Another is the specific birth defect for folic acid deficiency is neural tube defects. The neural tube defects may specifically affect the major functions and systems of the body. So, nervous system. There could be also folic acid deficiency may lead also to premature birth, low birth weight, premature separation of placenta. The premature separation of placenta is very risky on the situation kasi supposedly, di ba, the baby goes out on the extrauterine and being delivered, then afterwards placenta follows. But if there could be premature separation of placenta while the baby is still inside or intrauterine, the detachment of the placenta may lead to the possibility of bleeding. And thus, it may cause suffocation, or it may cause problem with the aspiration of the baby and may lead to fetal to distress eventually. So very risky. not just only for the baby but also for the mother, because premature separation of the placenta may lead also to profuse bleeding. So pwedeng mag-cause ito ng problem with decreased volume of blood of the mother or hypovolemia. So obviously with this condition of folic acid deficiency, these are the 5 that you need to take into consideration why this is very important. Okay? So that's why hindi katulad ng iron base usually at the start of the third trimester. So at the start of the third trimester yan yung nag-start yung problem with decreased hematocrit. So almost yan mga early 6 month. Okay, 6 month of pregnancy. Unlike for folic acid, it's continuous from the start of the pregnancy until the end of the trimester, simply because nervous system development is very significant for the baby or for the fetus. Now, when we talk about adverse reactions, okay, when it comes to adverse reactions, what we have mentioned about adverse reactions, so these are the unexpected effects of the drug, which is obviously the opposite of the side effect. So you must take into consideration, nurses, to withhold the drug if the mother is already experiencing allergic bronchospasm. What do you mean by allergic bronchospasm? If the mother's airway passages, specifically the bronchi, may cause the constriction or spasm. So what will happen? Will there be a problem with the gas exchange, class? If there will be bronchospasm, class? Will there be a problem with gas exchange? Yes. So will there be a possibility that the mother and the fetus will be deprived from oxygenation?
Yes po.
Yes.
Will there be a possibility that the mother and the fetus or the baby in the intrauterine may experience toxic level of carbon dioxide?
Yes po.
Yes, because the carbon dioxide is not being exhaled due to this spasm. So that's why very, very relevant for a nurse to consider na pag nagkokosto ng, pag sinabi kasi nating allergic bronchospasm, it always entail a concern with hypersensitivity or allergic reaction. That's why if you will notice, the 1 to 5 that I have enumerated here is related to manifestations of allergic or hypersensitivity reactions. So usually, di ba, pag mayro most for you have known any individual you have known for asthma or having asthma, so once they are exposed to allergens, the most common manifestation is difficulty of breathing, because it always direct the histamine 1 that will cause bronchospasm. Similar with the drug that may cause the possibility na the person could be having as a hypersensitivity reaction. That's why it's very important, class it's very important. Any drug, medication history is very important. History of hypersensitivity reaction and allergic reaction to any drugs are very important, because preventive, because it may lead to fatality. One of the adverse reactions also is we have the rash. Okay, again, what is the term? Since we have discussed this before, what is the term that is being used for rashes, allergic reaction or hypersensitivity reaction? Can you still remember it? What is the rashes or what you call this, the term used for allergic reaction? That is urti. If you can still remember it, that's
Urticaria.
urticaria. Very good. The urticaria is the type of rash that are being identified to hypersensitivity reaction. When we say pruritus, this refers to what? Anyone? If we are referring to pruritus, what does it mean? What this medical term means? Pruritus. Anyone? Pruritus is related to itchiness. Okay, di ba? Usually when there is allergic reaction, it comes because of the histamine 1 Histamine 1, release of the histamine 1. Erythema. This is related to redness. And general malay is related to weakness. So again, the rashes that are identified into adverse reactions of folic acid supplementation is urticaria. Pruritus is referring to itchiness. Erythema is related to redness, and general malaise is related to weakness. If these adverse reactions are being observed, then withhold folic acid. And who will take note of that? Nurses. You don't need you don't need to wait for the doctor's intervention, but the nurse may have the independent decision to withhold the drug as long as we are considering the safety and we have identified that these are already adverse reactions of drugs. Next, we will now proceed to some drugs, complementary and alternative therapies. Class, I know for some there are situations like your relatives abroad, in the US, in the UK, may send some herbal supplements to you. But if you will encounter these herbal drugs, these are the drugs that are significantly be avoided. Must be, it must be avoided. This is the term, must be avoided to pregnant mothers. Let's start. We have an herbal preparation. So you are seeing you are seeing this is a vegetarian capsule, a dietary supplement, feverfew and sage. Okay, so I'm talking about that this drug should be avoided because if you will check in any drug handbook, it's already identified with pregnancy risk categories of drugs. Why? These are considered emmenagogues. What do you mean by emmenagogues? Anything that will increase menstrual flow, if it is what we call emmenagogues. For a pregnant mother ba, if the pregnant mother takes this feverfew and sage, will she be high risk for spontaneous abortion?
Yes po.
Yes. So that's why nurses, you have a key role to really watch out any drug, herbal, supplements that are being taken by pregnant clients that you have known, because this will stimulate blood flow in the uterus and thus may lead to induced bleeding and thus may risk to abortion. So this is one, feverfew and sage. So if we say emmenagogues, these are drugs that may increase menstrual flow, which is obviously for a pregnant woman, menstruation are impede. So if ever the feverfew and sage will be taken and it will induce its emmenagogue property, then this may lead to profuse bleeding and risk for abortion. So be careful. Next, kaba-kaba extract. O, di ba? Kaba-kaba. Kaba-kaba or kava as a stress relief. Yan, as stress relief. Herbal supplement ito for stress. This is not acceptable. This is not advisable for pregnant women because this will lead to decreased platelet. Remember class, di ba, for early third trimester, it is expected for a pregnant client to decrease hematocrit. Then eventually, it may, if the person will take this kava or herbal supplement, the decreased platelet ba may cause further bleeding because platelet has a major role when it comes to clotting. Yes or no?
Yes po.
Yes. So anything, yan, baka somehow in your own homes you have this. It may decreases platelet for pregnant mothers. Okay? Next po, Dong Quai. Ayan ha, Dong Quai. Dong Quai is a vegetarian capsule, a dietary supplement. Dong Quai, garlic, Ginkgo biloba. Ginkgo biloba. Usually, this is taken into cautious. Actually, hindi much better not to be taken by pregnant mothers because nga it may increase bleeding when used with anticoagulant. So, di ba, when we say anticoagulant, these are the drugs ending in rin. Warfarin, aspirin, heparin. So, all drugs ending in rin, much if the person or pregnant mother takes this drug. Ginkgo biloba for sure, even it's a component of the herbal supplement, don't ever advise. Because nga, lalo na, even if the person is not taking anticoagulant, tapos has history of anemia, has history of decrease in platelet, it may take chance to risk for bleeding. So ito po yan, mga herbal na Dong Quai, garlic ha, the garlic, the bawang that we're talking about may cause increased bleeding when used with anticoagulant. So better avoid this for pregnant mothers. Next, familiar with this? Ginseng. Okay, ginseng. Ginseng, as it supports usually, this drug supports usually for the energy and immune as an herbal, herbal. No approved therapeutic claims. However, this could be avoided because it decreases the action of anticoagulants. Now, kasi this is naman on the situation that when a pregnant mother is unexpectedly leads to premature bleeding. Tapos the person pa is taking ginseng, ayun, hindi magkokos ng pag-prevent ng bleeding, rather it may induce bleeding. So careful, careful, careful. Next, other than ginseng, etong St. John's wort. Ang St. John's wort, so medyo di ba? Medyo class herbal supplement. Actually, ang St. John's wort is an herbal supplement for mood. It promotes positive mood. Yan. Kung meron tayo here in the Philippines on the mga memory plus, yan for the memory. Ito naman is for mood enhancer ito. Pero it's still no approved therapeutic claims because it's an herbal supplement. Now, the risk for a pregnant mother of taking this St. John's wort is its mutagenic effect on the cells of developing embryo and fetus. In short, chances of birth defect, chances of physical and congenital abnormalities. Yan. So medyo risky. If you will notice from the others, other herbal supplements that we have mentioned from 1 to 5, common is problem with bleeding. But with St. John's wort, this is a problem that will direct risk for a possible fetal or birth defect. Okay, next. We have penny royal. Okay, what are these penny royal? Penny royal is an organic supplement, okay? However, these are what the effect of this drug when taken orally or applied to skin, applied to skin for some topical preparation could be abortifacient. What do you mean by abortifacient? Abortifacient. What does it mean? Abortifacient. Anyone? Abortifacient. Abortifacient meaning it may lead to abortion. Okay? So penny royal taken by mouth or applied to skin can be abortifacient. So that's why this herbal supplements are somehow having studies of of banning because of this problem. So that's why it must be avoided with pregnant mothers. So abortive patient, it may induce abortion. Now, let us now proceed to some of drugs for minor discomforts of pregnancy. So we have identified mga minor discomforts, nausea and vomiting, pain. What are those other discomforts? Nausea and vomiting, pain, headache, yan. These are the usual discomforts during pregnancy. So, class, if ever, nausea and vomiting, we may identify, we have already identified its physiologic consideration why pregnant mothers are experiencing nausea and vomiting. It's because, again nga, the increased gastric pH, which leads to the possibility of acidic reactions that leads to increased hydrochloric acid. Now, what is the drug of choice? We are now leading to drug of choice. But again, as what I have told you, when a person experiences nausea and vomiting, let's start first with our independent function rather than proceed to the drug supplement. So if the person has nausea and vomiting, you may offer ice chips. Okay? The ice chips may cause the esophageal, it may cause the esophageal constriction so that it may prevent acid reflux. That will do. So pwedeng by mouth yan, acid reflux. Another is to prevent vomiting, you may offer crackers because the crackers could support the balance between the acidity with the acidity level in the stomach. So those are some supportive measures. But if this didn't work, then this will proceed to these drugs. So the drug of choice for nausea and vomiting is pyridoxine or B6. Kanina ang vitamin B9 is folic acid. Yun pala, to prevent nausea and vomiting, pyridoxine or vitamin B6, which is considered as category A. So going back to the pregnancy risk category, if we are saying it's category A, it means that there are no evidence of risk for maternal and the fetus, and there is sufficient and adequate studies. So very proven to, kaya that's why it's a drug of choice. Now, usually the one that causes this effect is yung coenzymes that will prevent or that will be very important for metabolic function so that it may prevent the vomiting. Now, the drug of choice is pyridoxine or B6, which is obviously a vitamin. However, you really need to consider some, so since you are aware of vitamin B, so probably the pregnant mothers experience nausea and vomiting may also be taught as part of the health education on foods that are rich in vitamin B, specifically vitamin B6. So that's why we have your subject in nutrition and diet therapy to support these discomforts and for you to be aware what are the specific foods and recommended daily allowances to support the alleviation of nausea and vomiting. Next, if there will be no pyridoxine, you may have doxylamine succinate and pyridoxine plus by pyridoxine. Actually, the one that causes eventually and triggering the nausea and vomiting is the histamine 1. Yung histamine 1, ang dami niya ng ang dami niya na it causes many major effects in the body, from the respiratory to the immune system to specific problems with the gastric. Now, that's why the drug that competes with HR receptor or histamine 1, so antihistamine ito, it has anticholinergic effect. Okay, so pag sinabi nating anticholinergic effect, it contradicts the action of the parasympathetic nervous system. Question again, what is the digestive activity of parasympathetic? Increase or decrease?
Decrease
Parasympathetic.
po.
Decrease. Okay. So increase. No, decrease or increase, I'm rather. Am I clear what's your answer? Increase or decrease? Parasympathetic.
Decrease po.
Decrease.
Are you sure? Decrease or
Increase po.
increase? Okay, it's increase for parasympathetic. So if it is anticholinergic, it will decrease digestive activity kasi cholinergic is identified with parasympathetic. And if it will prevent the cholinergic effect and decrease and to prevent the increase of digestive activity, it may prevent also production of hydrochloric acid. So that's why consider this drug doxylamine succinate pyridoxine as anticholinergic. If we say nausea and vomiting, the drug of choice is pyridoxine. So these are the common questions that you may encounter in the board exam. Usually yan, most of the questions that have been integrated are related to drug of choice. If they will, it will emphasize also an anticholinergic drug that competes with HR receptors and alleviates minor discomforts of nausea and vomiting. The answer is doxylamine succinate pyridoxine. So yan. Pero remember po, this is not for use by nursing mothers. What do you mean by nursing mothers? This is not for use when you are
Breastfeed.
yeah, very good. Not used for mothers who are taking breast. Bakit kaya? May question. Why? Why? Kasi alam natin, 'di ba, ang mga antihistamine, ano yung sabi ko mga examples ng antihistamine? Yung may mga amine, phenylpropanolamine, chlorphenamine, yan yung 'di ba kung nadidinig yung mga claritine, yan. Chlorphenamine, phenylpropanolamine, diphenhydramine. Plus 'di ba, this may have the drowsy effect. So for chances, pwede 'di ba one of the minor excretion of drugs could be via breast milk eh. So pwedeng ma-transfer papunta sa baby or sa newborn yung effect din ng drug. Kaya not for use by nursing mothers. So question, naglalag po kayo. Okay. Is my audio clear?
Yes,
Ayun
sir.
po, yes po.
Okay na? Okay, sige. Yung pala na-hold ko, natakpan ko pala siya. Okay, thank you for reminding. Hawak ko kasi yung ano. Okay, now. So, class when you will answer board exam questions, always remember drug of choice. Usually yan. Most common questions. Drug of choice. Next drug. Ito very common ito. I've been a delivery room nurse and assigned also in the labor room. These are common drugs that are being given. Prometazine. Yan. Prometazine. These are phenothiazines. Although category C. So what does it mean kung why is it category C? Ano yung problem natin with category C? 'Di ba? Category A, adequate and sufficient studies, no evidence of effects for maternal and the fetus. Category B, no evidence of studies, no evidence of risk but no sufficient studies for both maternal and the fetus. But for category C, it has identified based from animal reproduction studies that there is adverse reaction for fetus. Careful na. Kaya that's why I have already introduced you primarily on the pregnancy risk categories kasi these drugs will eventually help you to be cautious and what you need to consider. Since categories siya and it has animal reproduction studies na may adverse reactions, ano ngayon ang dapat mo, what will be your major role to consider is to monitor the fetal heart tone, to monitor the fetal heart rate. Because somehow etong problem. Prometazine competes the same ito with HR receptor na we have mentioned a while ago with doxylamine succinate. Now, since this is a higher level ng risk category, this is not given advisable. So that's why you need to consider mga contraindications. These are contraindicated with CNS depression. What do you mean by CNS depression? We are not talking about depression of we're not talking about the depression related to anxiety. We're talking about the depression that significantly affects the cerebral function. If it will cause CNS depression po class, yung effect ng drowsiness itself ay pwedeng mag-lead yan sa respiratory and cardiac complications. So pag nagkaroon ng CNS depression, pwedeng maapektahan si medulla oblongata, which is related to the function of the respiratory system and respiration itself. So pwedeng masuppress ang respiratory at ang cardiac. So pag medyo mababa, class, remember ha, so if the cardiac rate, pulse rate, respiratory rate are lower than normal, so obviously it's a deviation, don't give Prometazine. Nurses, you can withhold the drug. If, for example, the patient has the heart rate of 52, 50, less than 60, you will tell the doctor, Doc, I did not administer Prometazine because the mother's heart rate is 52. How much more that if the mother's heart rate is below, it may also a direct effect to the fetus, which is eventually less blood volume are circulating to the fetus. So if you will still give Prometazine, you are inducing what? You're inducing and blocking circulation towards the fetus. So somehow pwedeng mag-cause yan ng fetal distress. Next, Scopalamine. So yung Scopalamine, if you will notice, familiar with the first one, doxylamine. Ito naman, Scopalamine. Ano yung common with H1 blocker or antihistamine? Drugs ending in amine, diphenhydramine, chlorphenamine, phenylpropanolamine, scopolamine, doxylamine. Yan, doxylamine. Now, these are also called as anticholinergic. Okay, anticholinergic. So it means that it inhibits the action of the parasympathetic nervous system. Now, if we say antagonizes, so we have diba, agonist and antagonist. Pag in antagonizes, it definitely block histamine, which is our problem is histamine 1. Now, this is now the concern. Category C, the Prometazine is category C because somehow contraindicated to with CNS depression that may affect the fetus. Here naman, Scopolamine is category C because of the risk and caution to patients with hepatic or renal impairment. Okay, those who may have problems with liver and kidney. So cautious tayo because it may lead to adverse reactions. So in this situation, your problem is nausea and vomiting, but these drugs that are presenting to you are common drugs that are given to patients, but you must have a role on how to promote safety. So as what we have mentioned, ano yung promotion of safety natin dun sa first, dun sa vitamin A. Sa vitamin B6 or pyridoxine. Even though it's a drug of choice, one thing that you need to consider is basically the problem with allergic reaction. Sa doxylamine, you're aware that it must not be given for breastfeeding mother. Next, for the Prometazine, it is contraindicated to be given to with CNS depression because it may induce respiratory and cardiac suppression. Sa Scopolamine naman, it is category C because it may possibly lead to a major aggravation or problems with hepatic or renal impairment. So these are the things that you need to take note as nurses. So what is the histamine that we're talking about that may lead to nausea and vomiting? The histamine 1 receptor. And this is the one that is being blocked. Okay, that's why antihistamine are very common. Now, another one is we have metoclopramide. Metoclopramide. Okay. Usually, class, very common ito when we are heading the client to an operation. This is to prevent aspiration because pag nag-vomit in terms of effect of anesthesia. Ang metoclopramide po, ang brand name nito ay Plasil, and this is prokinetic agent. What do we mean by prokinetic agent? So prokinetic agent is pro-kinetic, kinetic motility, movement. So usually if there are content of the stomach that may lead to aggravation of nausea and vomiting, usually ang binablock nito ay yung dopamine receptor. So yung dopamine receptor naman, ang ginagawa nito is emptying. Okay, emptying. Ini-enhance niya yung motility ng gastric such ina-accelerate niya yung emptying without stimulating secretion. So it means yung secretions kasi yun yung pwede kasing mag-lead into the possible dehydration. So nag-empty siya ng stomach so that to, 'di ba, somehow we have this feeling naman na pagka we experience vomiting, mas nagiginhawahan tayo because the emptying of the stomach already releases too much acid, the toxins that we may have. So that's a compensatory mechanism. However, the drug that may also help in nausea and vomiting, specifically in vomiting is metoclopramide. It is category B. Now, category B, so it's no evidence, or there are no evidence of risk for maternal and the fetus. However, category B has no sufficient studies. So nurses, try to take into consideration why it is important to have the FDA risk categories, because you will be guided what is safe for your client. So pinaka-safe among is category A, right? That's why it is also what you call this? It is also a way to identify that you will promote and prioritize safety because you are giving the drug which is the drug of choice. Why it is drug of choice? Because it's category A. It's proven. All the drug literature says that this is safe for the fetus, for the fetus, or for the fetal well-being, and for the mother on the maternal well-being. Okay? So the next is all about pain. Okay? Now, usually for 26 week of pregnancy, kung week 26 of pregnancy, usually these are the things that usually mga hormonally induced, ang hormonal imbalances are already happening on the 26 weeks of pregnancy. That's why usually dito na lumalabas yung headache, sinus congestion, eye strain for pregnancy. Usually the drug of choice that can be used from first, second, and third trimester is acetaminophen. We mentioned this acetaminophen. It's non-opioid analgesic. Oh, we all know, di ba, that we mentioned before, ang opioid analgesic or narcotic analgesic has a direct effect on drowsiness. So if it is non-opioid, it's safe. So it could be safe for the mom and for the fetus. So the maximum dose is 300 milligrams and it should not exceed 12 tablets for 24 hours. Kasi class, pag nag-exceed po kayo ng 12 tablets for 24 hours of 325 milligrams, potential for kidney and liver toxicity. So that's why most pain relievers are potential risk for injury of both kidney and the liver rather. So that's why acetaminophen, again, is a drug of choice, but it has limitations when it comes to doses. Maximum of 12 tablets is only advisable for 325 milligrams. Maximum daily dose is 300 milligrams. So this could be used for all that trimesters. Heartburn. Okay, ano yung do anyone knows heartburn? Do anyone knows heartburn? Why
Acid.
it's yeah, I
Ito
heard
po
the answer.
tumatama malapit sa heart. Pag umangat po yung acid, malapit
Correct.
po sa heart. Nasasama po siya dun sa heartburn. Yan yung tawag nila.
Yeah. You have correct answer. Actually, 'di ba when a pregnant mother has the increased gastric pH, there is a reflux of the acid, what will happen is it will expand the esophagus. Okay, esophageal. Kaya kasi supposedly ang acid mag-cause ng constriction eh. Pero somehow yung acid itself mismo ay pag nag-cause ng expansion of the esophageal area, nagko-cause yan ng anatomical structure. It may cause friction with the pericardial tissues of the heart. Kaya pag nagkaroon ng friction yan, that causes the heartburn. Yun yung tinatawag natin heartburn. Kaya that's why pag may mga gastric reflux, heartburn, it's because of the reflux of the acid and the esophageal friction to the heart. And usually 80% of pregnant patients are the ones na nakaka-experience nito. And ang usual nito, class, heartburn is also called as pyrosis. So, tatanungin kayo, why a pregnant mother experiences heartburn? Your answer is definitely related to increased progesterone. Okay. Yung increased progesterone causes decreased gastric motility. Wait, sir. Nag-increase yung progesterone, nag-decrease yung motility, so dapat magdi-decrease yung hydrochloric acid. Nag-decrease ang motility, but because of the increased progesterone, kahit decrease ang motility mo, tumataas ang hydrochloric acid. So can you imagine that? So this usually happens to 80% of pregnant patients. So what are the drugs that may be advisable for patients with heartburn? So familiar tayo dito, na-mention natin to, aluminum hydroxide. These are antacids, right? And ano yung na-mention ko sa inyo, pag aluminum, ang common side effect niya, constipation. Si magnesium, ang common side effect niya ay diarrhea. So that's why these are over-the-counter drugs naman for heartburn. So aluminum hydroxide could be, so kahit naman kayo, if you experiences heartburn, aluminum hydroxide, Gaviscon, generic, is advisable for it. Next, another is magnesium hydroxide, aluminum hydroxide with simeticone. I know you are familiar with this. Are you familiar with this magnesium hydroxide, aluminum hydroxide with simeticone? If you are aware of Simeco or simeticone mismo, the drug, these are antacids. So anything magnesium, aluminum, simeticone are antacids. However, category C. Ayan na yung problem. Category C. So somehow animal reproduction studies may lead to possible adverse reactions to the fetus. So kailangan maging cautious. Okay? So usually kasi, class, di ba, as I even told you, pag nagdi-decrease ang gastric motility at ang intestinal motility mo naman ay nag-increase, doon nagpo-form yung gas. So di ba yung tinatawag nating gas, usually yan yung nagkakaroon ng abdominal distension. At usually, yung pasyente mo, most of the time frequently nagpapas ng flatus or utot ng utot ang pasyente. So that's an indication of abdominal distension. So ang tawag doon to prevent abdominal distension is antiplatulant. So antiplatulant din siya, tapos dinoneutralize na rin yung gastric acid. So again, as to prevent the heartburn, kanina we have aluminum hydroxide. Then etong second natin, although it's category C, it's still an antacid, magnesium hydroxide plus aluminum. So the side effect pa rin ay constipation kasi may aluminum. So klasa, ito po ang isa sa mga dapat yung tandaan. When you are giving antacids sa mga patients natin who may have any renal disease, don't give magnesium-based antacids. pwedeng mag-lead yan to major renal problems. Okay? So, these are related to the heartburn. Okay, so it seems na doble. Yan. So siguro before we proceed with the drugs that decrease uterine muscle contractility or preterm labor, probably we may have a 10-minute break for health break, and we'll be back at 6:35. So let's have first our health break. But before we proceed, do you have any questions? Do you have any questions? Okay, if none, I see heart emoticons. So you may have first your health break, hydrate yourselves, and stretch your extremities so that to promote circulation. 10-minute health break. Be back at 6:36. Thank you. Okay, let us continue. Are you here already, students?
Yes po.
Okay, let us continue po. Okay, now, we will now proceed to, we have discussed about minor discomforts and what are those drugs for minor discomforts. So we have identified nausea and vomiting, we have pain, we have the pyrosis or heartburn. Now, we will now proceed to drugs that decrease uterine muscle contractility. So actually, these terms, two terms that are projected on the slide are very significant when it comes to these drugs. And why are these drugs being given? So obviously, its purpose is to decrease uterine muscle contraction because it's every time that may cause uterine muscle contraction, it will increase uterine pressure and chances it may open the cervix. Okay? So usually between the 20 weeks to 37 weeks, it's not yet expected to, at least for a mother who's pregnant, will experience preterm labor. Kasi every time that a mother experiences labor, the most common sign is abdominal tenderness. The abdominal tenderness is an indication of strong uterine contractions. If there will be strong uterine contractions, it will also facilitate pressure inside intrauterine pressure that may affect the fetus. So that's why if you are now on the concepts about labor and delivery, the more that it progresses the labor, the chances of the time that the baby is ready to be delivered. If the age of gestation and expected date of confinement is appropriate on that time, so that not to consider the baby is premature or preterm. Now, if ever, what are those situations that may possibly trigger preterm labor? Anyone? What are those situations that may trigger preterm labor? Obviously, these are the weeks that may not supposedly expect. Kasi di ba usually pag nag-preterm labor, ano yung mga usual we may not expect gush of blood. It's not expected. Pag may gush of blood, that's an spotting, right? The vaginal spotting is an indication na preterm labor siya. Another is that's an indication na pwedeng ang cervix ay nag-open, which is supposedly it must not open because that's an indication of intrauterine pressure. Another is if there is passage of amniotic fluid, then obviously that is not also normal on weeks that are not identified to be considered as preterm. So this may take risk na ang concern kasi natin, if it will cause preterm labor, there's a possibility also of risk of preterm delivery. And that may compromise the fetal well-being, and that may also take risk on the condition of the mother. Usually, in the preterm labor, cervical changes and uterine contractions occur. Remember this, we could say this as preterm labor if it is between 20 and 37 weeks. If it is 20 weeks, it occurs abdominal contractions, and usually pag strong contractions yan, you will consider the time you will consider the time of interval. If the time that you are monitoring is regular, kasi it may consider the time and the severity The more that the abdominal pain or contraction is severe at strong contraction, strong labor contractions, and pain as well as severe. That's an indication that the strong labor itself may affect the fetal well-being, which is not appropriate for 20 to 37 weeks. So pag nagka-experience kayo ng paninigas ng tiyan, tapos yung paninigas ng tiyan, yung abdominal, kaya minsan nga pag may abdominal distension, kahit kabag yan, it may trigger uterine contraction. Constipation, it may cause triggering also of uterine contraction. So that's why there's a need for a pregnant mother to declare if she's constipated. So these are the situation. Kaya if you will notice, those who are on the preterm labor will be given a drug to prevent, such as anti-contraction drugs, and will be advised on complete bed rest. Di ba usually yan when you watch teleseries and series na related to this concept, that they are advised only on bed and they are not allowed to go out of bed. So because of chances that it may trigger the strong uterine contractions. Anxiety is also one that may trigger preterm labor. Ano pa? Physical stress.
Sperm, sir.
Come again?
Sperm po.
Come again?
Sperm.
Yeah, exactly. Kasi may mga situations that abstinence of sexual activities during pregnancy are being advised by the doctor if high risk for preterm labor, because the activities itself of the sperm may trigger uterine contractions as well eh. So although it's not inhibited during pregnancy ang sexual activities, but it is advisable to abstain any sexual activities when there is preterm labor. So remember the time, the period rather, between 20 to 37 weeks. So what could be the therapy to prevent the preterm labor? It's tocolytic therapy. If we say tocolytic, this refers to anti-contraction therapy. Tocolytic. These are drugs that are usually used to decrease uterine muscle contractions. And usually, the goals of tocolytic therapy is first and foremost to interrupt or inhibit uterine contractions. Why? Kasi class, remember as what I've told you. For example, this is a cervix, ha? For example, how can I project this? This is the cervix. Okay, this is the cervix. Pag nagko-contract pag nagko-contract ang uterus, ang uterine muscle, may possibility na mag-open yan. Okay? Ito, yan. Pwedeng mag-cause ng opening yan. At once mag-cause yan ng opening, the chances also that the fetus will expel, which is not supposedly the time, because it may lead to preterm delivery. So, ine-prevent natin yon kasi there are some instances that if it is preterm, the viability or chances of the baby to survive may not be possible. Kaya kino-control. So that's why we need to interrupt or inhibit uterine contractions. Second is we need to delay the delivery so that this is the concern. Why do we need tocolytic therapy? Because between 20 to 37 weeks, the lungs of the fetus are not yet well developed. The lungs may not be maturely be dependent, or rather be independent when it comes to respiration or gas exchange. So that's why pag preterm labor, if there will be preterm delivery, one of the concerns, pasok agad yan, di ba, sa incubator, simply because the baby cannot regulate his or her own temperature. Second, oxygen could be administered on a high flow because the newborn may not support his or her own respiration because of fetal lung maturation. So yon, kailangan we need to delay delivery as well because of the concern with fetal lung maturation. Another is if tocolytic, for example, the preterm labor is not inhibited anymore. But we need to control it once the mother will be transported to the hospital. Kasi ang mangyayari yan, if it will not control the uterine contraction, the greater chances that it will be delivered anywhere. Kaya that's why there are some instances, even for preterm labor, nagkakaroon na ng chances of preterm delivery na hindi na umaabot in the hospital because the patient doesn't have access on the tocolytics or drugs that may prevent contraction. Another is, another goal when it comes to decrease uterine muscle contractility is eventually, sir, pag may mga instances na ganito pag nagpe-preterm labor, nag-preterm labor siya pero nag-open na ng 2 cm yung 2 cm yung cervix niya. So what do you mean by 2 cm? Class, if you will see, ito po kasi ako I've been a nurse in the labor room and I have experienced how to do internal examination. So pagka nagkaroon ng IE, we check it by 1 cm. 1 cm. This is 2 cm. So 2 cm by ruler, 3, 4, 5, 6, 7, 8, 9, 10. So yung 10 ito. Ibig sabihin, that's fully dilated and the cervix are fully open to expel the baby in the extrauterine. Pero hindi dapat yan. Kung mag 2 cm yan, sir, pwede ba yan magsara? Hindi na yan magsasara. Kung 2 cm na yan nag-open, hindi na yan. So that's why ang pine-prevent natin is to continue, kasi the more that it will continue uterine contraction, that is associated na nagke-create ng cervical effacement. Nag-o-open yan pag nagtutuloy ang preterm labor. At pag nagpo-progress ang labor mo into its pace, higher pace of labor, lalong nag-o-open, nag-i-induce ng opening of cervix and chances of the premature or preterm delivery. So what are those drugs that may decrease uterine muscle contractions? So the drugs that could technically prevent uterine contractions are, number 1, we have terbutaline. Okay. Class, usually ang terbutaline, these are beta-1 adrenergic agents. So class, let us remember, beta-1 is a receptor, beta-2 is a receptor. Beta-1 is associated with respiratory tract, beta-2 is associated with the heart. Kaya pag sinabing beta-2 receptor. Beta-2 receptor is directed to the heart. Beta-1 receptor is directed to the respiratory system. Ngayon, ano ang need natin dito? Yung beta-1 or yung beta-2? Yung beta-1. Kasi the beta-1 is the specifically, ang action nito ay nire-relax niya ang uterine smooth muscle. Okay? So the beta-1 adrenergic agents. This is the drug, although ang effect niya ay sa respiratory, pero isa sa mga indications niya ay nire-relax niya ang smooth muscle of the uterus. So it means it decreases the pressure, nadi-decrease ngayon yung contraction. However, it's category C. Okay, what's category C? According to the animal reproduction studies, posibleng mag-cause ng adverse reaction sa fetus. Now, hindi naman natin sinasabi na directly magkakaroon ng adverse reaction kasi sa category category X, birth defects talaga. Sa category D talagang merong identified adverse reactions. Ito ay sinasabi natin na may findings sa animals, but pag category C, we need to be cautious. So what do we mean by this? Usually these drugs, we need to monitor the fetal heart rate of the patient and the baby or the fetus, fetal heart rate, simply because I'm sorry, I stand corrected. You must monitor the fetal heart tone of the baby simply because to identify if the baby is experiencing fetal distress. Kaya that is important. Kaya pag mga category C, always take into consideration the fetal well-being. You must be cautious. Okay? So, now, number 2, magnesium sulfate. Okay? Ang magnesium sulfate ay least commonly used. Why? Category D eh. So what do we meant by category D? Ang category D, sabi natin, has a positive adverse reactions for both maternal and the fetus. Kaya medyo nasa least commonly used yan for category D. And usually this is contraindicated in patients with myasthenia gravis. Ang myasthenia gravis po ay problem with the nerves na physically pwedeng nakaka-affect yan sa mga nerve endings. And in these situations, ang magnesium sulfate po, class remember, I don't know if this was discussed during your health assessment, yung assessment of deep tendon reflexes. Did that presented to you? Yung mga reflexes? Not yet.
Yes po.
Okay. So yung pag-assess using neurohammer, yung pag-assess ng deep tendon reflexes is very important when you are giving magnesium sulfate. Why? Plus, pag walang response ang patient natin with deep tendon reflex, don't give the drug. Because if there are no response on deep tendon reflexes and you still give the drug, it may lead to paralysis of the client. So careful. Kaya nga siya nagiging least commonly used kasi high risk siya for paralysis. And you need to be confident in checking the deep tendon reflexes. Ngayon, I know that you have watched about the antidotes, and yung magnesium sulfate po class, usually pag mabilis din kasi ito mag-cause ng toxic level eh. Kaya rin siya nagiging least commonly used kasi very small percentage na mag-overdose ka dito. It will really lead to toxicity level. So that's why as nurses, you need to know the antidote. So the antidote for magnesium sulfate is calcium gluconate. So yan lang mga kailangan yung i-highlight. Calcium gluconate is the antidote for magnesium sulfate. So always check deep tendon reflexes if magnesium sulfate is being given. Next. Ayan. Usually in this illustration, 'di ba sabi ko nga sa inyo ang preterm labor is between 20 to 37 weeks. So these are the mga uterine relaxants other than magnesium sulfate, terbutaline. Alam niyo po rin ba na ang nifedipine at etong mga non-steroidal anti-inflammatory drug are also uterine relaxants, but we may not focus on this. But however, I have already introduced to you terbutaline and the magnesium sulfate. Okay, now let's now proceed to preterm labor on corticosteroids. Sir, why do we need to give corticosteroids? Class, situations like na between 20 to 37 weeks, yung cervix niya nag-o-open na from 2, tuloy-tuloy na yung pag nagpo-progress na yung preterm labor niya ha. Nagpo-progress na yung from the phases of labor. Tapos papunta na siya dun sa progressive phase. Nag-o-open yung cervix niya from 5 centimeters, 6 centimeters. So very close na for preterm delivery. Do you know that we have the patient who is on preterm labor and at risk of preterm delivery are given may undergo corticosteroid therapy? Oh sir, we're familiar with that, corticosteroid, those drugs ending in zone. Why? Remember class, when I mentioned what is the purpose of having tocolytic therapy is to have a fully developed fetal lungs. Kasi nga, yan ang kailangan, this is the time that we need to prepare the baby on the extrauterine life. So while projecting and chances because of the progression of labor and the opening of the cervix and chances to have preterm labor, the obstetrician may possibly order for corticosteroid therapy. And usually, pag ang mga patients natin ay at risk na ng 24 to 34 weeks, yan, yung talaga magpi-preterm delivery na ng 24 to 34 weeks, these drugs are being given, corticosteroid therapy is given for purposes of having a strong lungs for babies. The most common drug to prevent respiratory distress syndrome among infants is by giving this drug to mothers prior to delivery. Betamethasone. This is a corticosteroid. Tandaan nyo to ha, very common. These are drugs that are commonly appearing in the board exam. Kasi it's category C, but this is it may have an adverse reaction, but we need to monitor lang. This is injected to mother, but it will stimulate surfactant. Alam niyo po yung surfactant? Yung surfactant are very important para mag-cause ng full development ng lungs. Kasi remember class di ba, what do we expect once the baby will be delivered extrauterine? Di ba we expect the baby to cry? Okay, the baby must cry. Why is it that we must expect the baby to cry? Because that's an evidence of what?
Na gumagana na po yung lungs niya.
Very good. That's an evidence that the lungs is having full expansion and the baby is facilitating respiration. That's why nga 'di ba usually our priority is to clear the airway by mouth kasi 'di ba mouth breather. Then at the same time we'll do tactile stimulation if the baby is not crying, because that is the time that once the baby cries, the lungs will fully expand. Pero in this situation, our concern is preterm delivery. So we may not expect that the lungs may be fully developed. So that's why betamethasone is being administered prior to delivery to produce surfactant. Other than that, we have also dexamethasone. Okay. Zone. So ang concern natin dito, same with betamethasone, but the difference with betamethasone is the drug of choice, to produce in helping the baby to have this full development and maturity of the lungs. However, if there is no available betamethasone, dexamethasone is the second choice. However, this is the problem. Dexamethasone has shorter half-life. So kung shorter ang half-life nito, short din yung effect. So that's the difference. Kaya that's why betamethasone is the drug of first choice and the second choice is dexa, because yung half-life niya is different, mas shorter with dexamethasone. And usually the surfactant that we're talking about that is very important for the lungs to be mature is the myelin or the lecithin. These are the two phospholipids that are very important surfactant for the lungs of the baby who is a preterm, who will be experiencing preterm delivery. So, betamethasone and we have dexamethasone. So, let us now proceed with the question and answer. Yes, Miss Trisha, any question?
Excited lang po.
Excited. Okay. Sige. That's what you call energy. Okay. A patient in her first trimester of pregnancy calls the nurse to ask for suggestions on decreasing nausea in the morning when she wakes. Which of the following non-pharmacologic measures are used to decrease nausea and vomiting except eating crackers, dry toast, or other carbohydrates before rising? B. Eating small frequent meals. C. Eating high protein bedtime snack. And letter D. Eating high fat or seasoned food. I think Miss Alangkas raised her hand. Your answer. Miss Alangkas?
Letter D po.
Letter D. So let's see. A while ago, I had mentioned about eating crackers. So expect this is a correct. So let's have. Okay. So very good. The answer is eating high fat or seasoned food. Why this is not suggested? Why this is not suggested for nausea and vomiting? Anyone? Anyone? I want to explore it in your mind. And why high fat or seasoned foods are not advisable as non-pharmacologic measures? Anyone? Yes, Mr. Buen Consejo.
Sir, since high fat food lasts in our stomach longer, thus they could induce vomiting, bloating, and stomach pain.
Yeah, very good. You're correct. Because, di ba, we have mentioned if it's high fat, it's insoluble. The longer period that it may be synthesized into our stomach, the greater chances that since it's insoluble, the higher chances that it may produce more hydrochloric acid. Moreover, with seasoned foods, because if we consider these seasoned foods, these are the foods that may not be synthesized easily in the stomach. So eating crackers is one. Small frequent meals could be high protein. That's advisable because high protein snacks or diet may help when it comes to the balance of gastric pH. So this is the one, letter D. Next question. A patient is complaining of continued constipation after non-pharmacologic constipation treatment was attempted without success. Which drug would be a first line of treatment for constipation during pregnancy? A. Docosate sodium. Letter B. Magnesium citrate. Letter C. Castor oil. Or letter D. Mineral oil. Class, I have not mentioned this in any of the slides. Try to set your mind that when you are taking board exam, questions are unexpected. So you need to choose the best. Yes, Miss Abilino.
Letter A po.
Letter A, docusate sodium. So tignan natin ha. Okay, correct. Alam nyo po, when you're taking into consideration that a patient is complaining of continued constipation, then after non-pharmacologic constipation treatment, after was attempted without success, so failure siya, which drug would be the first line of treatment? Why not magnesium? Why not magnesium? Kasi di ba I mentioned to you class, when we discuss antacid, ang magnesium nagkukos siya ng diarrhea. Di ba as side effect? So pag nagkukos siya ng diarrhea, mag-i-induce yan ng increased intestinal motility. At ang increased intestinal motility, magti-trigger yan ng uterine contraction. Another, do you know that castor oil and mineral oil at mga laxative, yung mga meron pa tayong mga gamot diyan na yung mga suppository for constipation, these are not advisable during with this situation of constipation. Why? Kasi sabi ko nga sa inyo, magnesium mag-trigger, castor oil and mineral oil will definitely induce excretion or emptying of the intestine and passing the stool. So pwede bang mag-trigger yung pag-induce mo ng intestinal motility to uterine contraction? The answer is yes. So by analysis, I have not presented this to you, pero you will think of the rationalization B, C, and D. Not familiar, pero these are the things na the oil pwedeng mag-cause yan ng motility, mineral oil, yes. So these are not advisable because these are laxatives na pwedeng mag-lead into and trigger uterine contraction. So the best answer is docusate sodium. Thank you very much. Next question. The nurse is teaching a pregnant patient how to decrease gastrointestinal distress she experiences with prenatal vitamins. The nurse instructs the patient to do what? Take her vitamins between meals. Letter B, eat when she takes her vitamins. Letter C, drink orange juice when she takes her vitamins. Next, drink milk when she takes her vitamins. Anyone? Yes, Miss Abante.
Try lang po din. Siguro letter A po.
Letter A. Sige, kasi we're looking for a situation to decrease gastrointestinal distress with the prenatal vitamins. Kasi we all know, di ba, we have mentioned na di ba sabi natin dun kanina sa mga supplements na nagkakaroon siya ng mga gastric irritations, nausea, vomiting. So what could be? So tingnan natin kung what could be the answer. Okay. Ito po yon. Why letter B? Di ba ang sabi ko sa inyo kanina, what could be the best that these supplements will be taken? Di ba it's best absorbed only with juice and water? Okay, now, so it could be taken once she takes her vitamins, then follow na yung meal. So para hindi mag-cause ng, kasi di ba sabi, best it is absorbed on an empty stomach, but it could be associated with water or juice. So ang concern natin ito is take her vitamins between meals. It's you have eaten, tapos take the vitamins, then by meal. So it's somehow between, for example, between breakfast and lunch, you will take in the middle yung brunch, or hindi ka kakain muna, and you will take the vitamins. So parang triggering din yon kasi it will continuously take it on an empty stomach. Kaya nga it's even on an empty stomach, dapat it could be taken with water or juice. Why sir, yun lang pala why not letter C? Class, why not letter C? Sabi mo, sir, take with juice Why not letter C?
Citrus po kasi yung orange.
Yes, Mr. Nicolai?
Citrus po yung
Very
orange.
good. Kasi di ba I have mentioned to you na too much acidic or high acid juices may trigger lalo yung chances of the acidity. Very good. O why not milk?
Sa absorption po siguro, sir.
Correct. Kasi it counteracts absorption. Ano po yung mga na-mention ko lang, di ba? Coffee, tea, sinabi ko na, milk tea, pinagsama na natin. Tapos cereals, eggs. So hindi dapat i-take yon with these vitamins. Okay. So somehow very tricky yung letter A and letter B. 'Di ba? But the most talaga is letter B. So at least I think those who have tried. Next po. The nurse at an infertility clinic is working with pre-conceptional couple. The nurse advised the woman to take which supplemental for at least 3 months before becoming pregnant. I think Miss Delarmente raised her hand first.
Din letter C po, folic acid.
Okay, let's see. So the answer is folic acid. Ayan. So even though class, 'di ba, ang folic acid usually, 'di ba, taken 'yan all throughout the semester Ang usually ang mga tinitake na ng mga iron base yung mga prior or before the third trimester. So yun yung may concern sa hematocrit. Pero ang folic acid ay etong iron is different, not for at least 3 months. So tricky rin, di ba? Medyo tricky din kasi di ba ang sabi natin ang iron is taken the late third trimester. So ito 3 months So nasa first trimester siya. So not iron. Why not ginger? Kasi usually 'di ba yung mga herbs na mga na-mention natin, Ginkgo biloba, kahit hindi ko na-mention doon garlic, mga root crops So pag ito ay nag-translate into a drink, pwedeng mag-trigger, 'di ba? Pwedeng mag-trigger. So vitamin B6 is not kasi we're talking about the pyridoxine. Okay, next po. Next, a primi gravida patient 8 gestational week is at the prenatal clinic for her first examination. She complains of nausea and vomiting every morning. Which comment made by the patient would indicate the need for further instruction? My friend gave me a ginger cookies to eat. I have been eating dry crackers before I get up. Letter C. I have tried to avoid foods with strong smells. I have been drinking chamomile tea every day. Which comment made by the patient would indicate the need for further instruction? Miss Lindsay May?
D po, D.
Answer?
D po.
D as in dry?
Opo.
Okay, so let's see. Let's see. You're correct. You're correct. Class, di ba? We must be careful of giving mga teas sa mga pregnant mothers, lalo na in the situations na hindi siya maglilid to comfort sa mga nakaka-experience of nausea and vomiting. However, eto kasi bakit kaya hindi itong ginger? Yung ginger naman nasa ano naman to? Gave me ginger cookies eh. Hindi naman siya yung concentrated na drink. Okay, so mas less yung amount niya. So between letter A and letter D, dito tayo sa chamomile tea kasi any tea na pwedeng mag-trigger ng risk sa lalong mag-trigger doon sa nausea and vomiting. So letter B is correct, letter C is also correct. So next question. Hindi na. So I think we will continue this on the next discussion. So I'll stop my sharing and stop the record.